Hello, everyone, and welcome back to the Lube Tube. My name is Jeanette Nashke, and this is my co-host, Brittany.
Brittany in the house.
Well, hi, Brittany.
Hey, Janet.
Did you have a good birthday?
I did. I had a wonderful birthday.
We had the best time at your little lake house party.
I know, that was fun. It makes me want a lake house more than a beach house now.
Well, yeah, but I've always kind of felt that way.
I don't know though, but then you go to the beach and you're like, oh man, I need a beach house.
Right. So maybe I buy a lake house, you buy the beach house, and we share it.
Makes perfect sense.
But time out. When we were up there at the lake, I told Daryl, all right, this is where I want to live. And he wrote back, Jay, they're starting at $2.5 million.
I know, man. They are not messing around in Horseshoe Bay. But
No.
I mean, those houses are stunning.
Stunning. Like so pretty. And what's great about that lake is it never goes dry, right? It's a continuous filled lake, which is so nice.
Yes.
Unlike where I grew up, Medina Lake, RIP. Yeah, it's like
it's so's Canyon. Honestly, all of these Texas lakes really need lots of help. Although it's April showers bring
May
flowers
and rain and water,
lake levels.
Okay, I like it. Well, let's kind of introduce this episode. This episode is going to be a little bit different than what we normally talk about. We have a really great guest that we're speaking with today. And this episode is all about body image and basically helping those around us that possibly will be going or have been going or are going through an eating disorder. So we're going to be speaking with Dr. Susan Mengden, who actually works here in the San Antonio area at a clinic called Esperanza. And I think that we've got a really good show ahead of us, and I'm excited about it.
Absolutely. And this particular episode is certainly not just for someone that's gone through it. We're talking about parents who have kids that are going through it, friends that have friends going through it, family. I think will actually be quite the universal episode. So I'm excited.
Yeah, I think it's an eye-opener. And I think that it's important for our listeners to realize that this is going on, right? Especially like, for example, in my situation, raising teenagers, right? I think we're going to talk about that a lot, is that, teenagers are always having this constant fear of body image. And there's so much pressure on these teenagers, boys and girls, and also as grown-ass women. I mean, I think that we are always trying to feel best. And maybe that best is what we're perceiving, right? And so, and what everybody else wants around us, but it's really not maybe the healthiest. So I think it's going to be super, super helpful.
Did you hear who was voted the world's most beautiful? I forget what People magazine calls it.
Oh no, who?
The most beautiful woman. If you had to guess, I don't know that you would guess, but this is kind of ironic that I'm talking about this. So I don't even guess, Jeanette, because that's too hard.
Okay.
Yes.
Megan Fox. She's pretty.
No, see, she is pretty. See, that guess is terrible though.
Okay.
I'm just kidding. People magazine usually does somebody though that's like there's things going on with them. So it was actually Demi Moore. Demi Moore won.
Oh yeah.
Or I shouldn't say won, but she was voted most beautiful. And this is interesting because she made a movie that was all about body image, all about aging, all about how everyone's just trying to keep up. So The Substance, I believe is what it's called. The Substance. I personally haven't seen it, but I've read about it and listened to some podcasts about it. So
she's always been so pretty though. Like,
I know.
She's gorgeous.
Stunning.
I mean, even when she shaved her head, right? You're like, holy crap, look how beautiful you are. And I loved that because obviously women who don't have hair, either for various reasons, got to see her, this beautiful woman without hair. And for once, it wasn't about a woman's hair. It was about her face, her facial structure, her smile, her eyes, and what she could bring across. So I loved it.
I feel like you could look good with a shaved head.
Should I try it? Like Britney? Not Britney, Britney Spears. Yeah. Should I go on a mental breakdown and shave my head?
No, okay. Man, she was going through some. Don't do it. Don't do it. I'm just saying, I bet you could pull it off because there are certain people that you look at them and with no hair and you're like, dang, you look good.
I know.
You really do look good.
How about her social media?
Which one? Give me more?
Brittany's. No, Brittany's.
Oh, no.
Oh
No.
God.
Let's
Do
not
you
go down
follow
that.
that?
I don't. Well, hello. I'm not
Oh
into
yeah,
the
antisocial
socials.
Brittany.
That would be me. Thank you.
Yeah, she's just, it
So,
hurts my heart. Okay, but anyways.
okay. Yeah, let's get into it. Okay. So, without further ado, Dr. Susan Mengden. So, just a few things about Dr. Susan Mengden. She is a certified eating disorder specialist, IADEP approved consultant, and certified group psychotherapist. She is also the founder and executive director of Esperanza Eating Disorder Center in San Antonio, Texas. Mengden is a native Texan and alumni of TMI Episcopal. She earned her BA, her MBA at UT Austin, and her MA and PhD in psychology from Boston College. Mengden has 35 years of clinical experience specializing in eating disorder treatment. She is the founder and board member of EDFSTX, a foundation geared to providing eating disorder education, awareness, and treatment scholarships to the underserved populations of South Texas. All righty, everybody. Let's welcome Dr. Susan Mengden to the podcast. Welcome.
Yes, welcome.
Thank you. So happy to be here.
So we're really excited about this because Brittany actually was the one who kind of took over and kind of got her into basically getting a meeting up to with basically wanting to talk to us. So I'm excited about this because, you know, the whole point of the Lube Tube is to talk about things that nobody wants to talk about. And that's kind of the point that we get across with every episode. But this episode is really important because we're going to talk about some eating disorders and talk about basically women and how the diet and the exercise and everything kind of comes together, and how some women really struggle with having to kind of mix that all in. And I really think it's important to talk about this because there are a lot of people that deal with eating disorders that nobody talks about. And it's one of those things in medicine. I know, you know, first case scenario when I've had ladies come in and it's something that I see that they're losing weight and I check their blood work and they look like they're not really getting as much nutrients as they possibly need to. And I'm able to hopefully talk to you today, as well as Brittany, obviously, and kind of give me some insight too, because I think not only can you help listeners, but you can help healthcare providers too. So I'm really happy to have you on today.
Thank you. It is such a specialty area. And so that is one thing that people do need to know is that graduate schools, medical schools, you do not get eating disorder education and knowledge. It has to be a specialty that you do after that. So yes, happy to be here to give you some information.
Absolutely.
You know what another thing that we've talked about is, yes, this could be personally affecting you, but truly a lot of this is about, hey, I have a loved one and they're going through this. How do I support them? What do I do? How do I make this better? Because there's so little information out there for people. I know personally, when I've had loved ones that are going through this, I didn't know what to do. I didn't know how to support them in the right way. I didn't know if I was saying the wrong thing or doing the wrong thing. So I know we talked about this, that anorexia among eating disorders, it holds the second highest mortality rate. And that's just behind opiate addiction. That is a crazy statistic.
Yes, and there's two or three reasons why it is the second highest that people don't know. One is that of the hypoglycemia. When somebody isn't eating enough and their blood sugars drop, they usually really drop at night. And so people will die of hypoglycemic episodes. They also will die of other, the eating disorders that purge. The electrolytes are often, expelled from the body and also not held in the body because of the muscle wasting. And that also causes heart attacks, some cardiac problems. And then the third reason that people with eating disorders die is because of suicide. And I do want people to know that when you're hungry or you're very upset with your appearance or upset with your eating behaviors, it causes severe depression and also causes, leads people to suicide. So it is a high mortality, which is why I believe that it is a specialty, because it really requires a team of people who know what they are doing to really help someone overcome and recover from an eating disorder. And you can recover. This is one of those not diseases, but one of those illnesses and mental illnesses that you can recover from.
Absolutely. And interestingly enough, I know before opiates kind of took off, it
Yes.
was
It was
ranked the
number
most
one.
deadly.
Yes.
Yeah. And that's crazy. That's crazy.
And you said that you had mentioned that, there's no graduate level programs focused specifically on these eating disorders. So like me as a provider, would I be able to like maybe take extra CME courses, or is there something that I could do in order to educate myself, obviously besides talking to you today, to help, these ladies? Is there something that we could do?
Yes. You can join an organization that's mission is about education for eating
Mhm.
disorders. And I'm on the board here of San Antonio. It's the International Association of Eating Disorder Professionals. We have trainings. We have a whole data bank in our national organization of all this training. So yes, it is getting trainings either by going to conferences and workshops here in San Antonio or the national or into the data bank. So yes, those would be available, and we can make those available to people here in San Antonio.
Awesome. Yeah, because we do have other medical providers that listen to the podcast, I know. And especially, for Brittany and myself, we're in women's health. So this would be very, very helpful for us as providers to be able to kind of educate ourselves on that. So thank you for that.
Yes, and one of the latest is on eating disorders and how they affect pregnancies and postpartum depression, which is
Oh,
higher when you have an eating
absolutely.
disorder. And so that information is out there as well for you.
Why don't we actually kind of piggyback on that and talk about the intersection of women's health and eating disorders?
So eating disorders really impact women's health, not only in our menstrual cycle, but also in your bone density and energy level, mental health, your libido, all of those. Think about it, your hormones are impacted. If you are too low of weight, which is indicative of an eating disorder, or if you are not eating correctly either and purging, even your medication doesn't work well. So that's one thing that people need to know too. So it impacts all those areas. And if you want specifics, ask away. I'll tell you.
Yeah, I know. I've actually had a lady, she was a young girl. She was probably about, I want to say she was 15. And she came to me and she had not started a period at this point, right? And she was 15 and mom was really concerned about it. And so as I dug a little bit more, she was underweight, right? And it actually turned out after, doing some significant history taking that she was dealing with purging. And so my goal for her was to not try to get her to start a period. It was more to fix the problem of why the period hasn't started. And so at that point, I referred her to someone like yourself in order to try to help her, nutritionist, and then also got her into a therapist because I don't think the mom knew. I don't think the mom knew that she was purging. I don't think the mom knew that she was having this struggle. And I find that these young girls are really good at hiding these things, right? And it's scary. It's scary.
Yes, and teenagers are very good at hiding their symptoms and justifying their symptoms because their symptoms are working for them. Usually someone who starts an eating disorder has had a negative body comment said to them. And there is so much body bullying out there now. Everyone who's listening, please know that and take it seriously because your children are hearing terrible things said to them, and it can lead to an eating disorder. So let's say this young girl starts purging. She has learned a way to manage her weight. And all the eating disorders are progressive in nature. So even though someone may start out, okay, I'm only going to purge once a week or something like that, it just increases until they truly can't stop it. And so the point is to try to find it early. And the reason people purge so quietly is because once the body gets used to purging, someone doesn't have to use any kind of manipulative. They can just tighten their stomach muscles and have a very quiet purge of something that they have eaten.
Hmm.
So that's another
Wow.
reason. I mean, even spouses don't know that someone is purging. So it is a scary thing for parents. The thing that, since you said this, I wanted to ask everyone, one of the ways that you can watch for your child's growth and development is to pay attention to their height, weight, growth chart. When someone's height and weight flat lines, 10, 11, 12, 13, 14, 15, and they don't keep going on the, say 25% or 50th percentile in their weight, then you suspect something because it's often that they're manipulating and you won't know.
Right. I'm glad you say that because I think a lot of us as moms, I'm a mom. We pay attention to growth charts when they're little, right? They're reaching those milestones. They're at 2 years old. They're where they're supposed to be. Are they in the 90th percentile where they are? And I think that at teenage years, we kind of forget to follow that anymore. That's coming out of the mom of 2 teenage boys, right?
Absolutely. And we're so pressured for our child to be thin. And a lot of times a child needs to gain weight before they get taller. And that is just so, I'm a mom too. We are very mother parent friendly in the eating disorder field because we really know that parents are trying to do the best they can and often will inadvertently, really help, someone by also saying, yes, you can lose weight now. You can.
Sure. Yeah, absolutely.
Can we talk a little bit about how eating disorders can affect fertility?
Yes. So eating disorders for most of the people that, there's several eating disorders. I'll take bulimia first. Bulimia is the eating disorder where someone eats and then purges. They run constantly dehydrated, which affects a fetus and leads to a lot of miscarriages. Okay. And so, because what happens when someone is bulimic, it's not like they just throw up in the morning like the person with nausea from being pregnant. They don't recover it later in the day. They will maybe throw up again, anything they eat. That's how bulimia progresses. So they're throwing up to everything. They throw up everything they consume. And so does anorexia purging type. So they don't hydrate. Their body is not hydrated, and that can cause miscarriages. For anorexia, often the estrogen levels tremendously drop, as do testosterone. Now, we're not talking about men here, but the estrogen drops very low. Some people have a spotty period, but most of the time, let's say about half the time, they lose their menses, but not everybody. But it makes it very difficult to get pregnant. For someone with binge eating disorder, their body, does other things with, usually we see something like maybe some PCOS that causes, and then there's difficulties there. And so, and certainly with blood sugars, when you are binging all the time, you'll have your blood sugar levels are high, and that also affects fertility. And how does it affect your libido? When you have a severe
This is important. This is
disorder,
definitely important.
it's important. Your libido just drops through the floor.
Mhm.
Plus
Sure.
your body image. All the eating disorders have negative, terrible body images. They hate their bodies. They want to hide. They don't want you to see them. They don't want you to touch their bodies. So all of that affects the ability to even get pregnant.
Right, right. So let's talk about if you have a loved one, if you have a child, somebody that you want to help, what are the best ways to identify and then to address things with them?
First is to notice,
Right.
is to notice it and to ask some questions. Often a teenager will say things like, I'm just eating healthy. And they start out with, I'm going to eat 1,200 calories a day and I'm going to lose weight. And then, wow, I did so good with that. A few weeks later, you'll hear, ooh, I'm now eating 800 calories a day. And look at me. I am doing great. I can do it. I have willpower. And, so you will hear from someone with anorexia the excitement about how they are denying themselves sustenance. The point to watch is if they flatline on their growth chart, if they are cutting out whole food groups, even though I know the diet industry is telling us to do that, we need all the food groups. And that's why we say there's no bad foods, because all the food groups have something that our body needs. And so you want to watch for that. You want to see if they are skipping lunch. That's hard to find out because they can throw their lunch away at school, or not eating breakfast, or just going to such low fat when they are a growing kid that they shouldn't do that. So it's really watching. And then if you suspect something, the Esperanza Eating Disorder Center, one of the things we do here, which is true of all the eating disorder higher levels of care, we all do free assessments, which means we will really ask all those questions, get the physicals. We'll look at the blood work, which for teenagers never really shows anything until it is a crisis. And then we'll, look at growth records, and we'll give recommendations. If you get somebody in early enough, usually what we'll say is go to one of these eating disorder dietitians. And I have provided y'all with the list of who in the community actually knows how to treat eating disorders, because not every dietitian does. It's a specialty, just like, the therapist. There are therapists in the community that specialize in this area of eating disorders. And you want somebody who knows what they're doing so that they just don't say, oh, you're fine. Your PCP can also help you, but can also be misinformed. There are some that really know when your heart rate gets into the 50s, that is a big warning sign. A lot of them, there are some that will say, oh, you're in great shape. And we'll go, but this is not a runner. This is not even how a runner's heart is. At this point. Yes. So it's really those things, and going to a dietitian that knows what they're doing, I would say.
And I just want to let our listeners know that, yes, you did share all that information with us, and we will have that to share with you guys as well. So we'll link it in our Instagram, but we'll also have it on our website. So if our listeners are dealing with this either personally or with somebody in their life, we will be able to share that information, especially if you're in the San Antonio area, because I know that you guys can be super, super helpful. So thank you for that.
Yes, we are more than happy to do that. People do online evaluations as well. And as a parent, you might say, well, my kid's going to lie to you. And we go, yes, but often we can point out where their inauthenticity, like I like to say it, it doesn't
That's a good way to put it.
It doesn't make sense. And we'll go,
yeah.
Yeah. But a lot of times they'll come in and they'll say, I'm trying this. For binge eating disorder, it's very different, because for binge eating disorder, you can see, once again, you can usually see the disorder. For atypical anorexia, you cannot see the disorder, parents. So you have to really watch how somebody is eating around you and wonder if they are, if they're feeding their bodies, because that eating disorder, someone eats anorexically, they're eating very low calories, but their weight is at a higher level. They're in a larger body, higher weight, so you don't notice it at fast. But they're, they throw off all their hormones as well by how they're eating.
I'm sure. One thing you did mention, which I think is great to hear, is that this is not just a female thing. This certainly happens in males as well, but seems to be maybe a little underdiagnosed in males. I don't know if that's the correct term.
I think it is. Here in San Antonio, there's a lot of myths about who has an eating disorder, the wealthy white woman. And I would like to say, Esperanza, we've always had a male. We've usually always had a military active duty soldier. And we also have a good number of transitioning teenagers and young adults.
Yeah, like I mentioned before, raising teenage boys, I do see this in, my teenage boys with their friends, with them personally. They are so focused on what they eat. I mean, I have a 12 and 14-year-old boy, and they're constantly talking about how they can eat, quote, healthier, end quote. And I'm thinking to myself, you know, at what point is too healthy, right? In their eyes, too much, right? Because they want to eat high protein, which they're getting their protein in, but is it really even enough protein for a growing multi-sport athlete boy, right? Probably not. Probably not, right?
Probably not. And then they'll, a lot of times, the way that the young boys are eating that are playing sports or lifting weights, or, they are ending up in that kind of, very restrictive eating pattern, followed by cheat days that are binge days. And
Yes.
so it sets that up. This is what we see in the military too. The military has higher rates of eating disorder. So if you are a military spouse, remember that your spouse could have an eating disorder, and because of the height weight requirements, that sets up the same thing. High levels of protein, low carb, low fat, and then the binge days.
Yeah, absolutely. And those binge days are insane. I mean, I remember because I was a college athlete, and I remember being around the male athletes, and their binge days were insane. I mean, like, how much food are you putting in your mouth on one day, and you're restricting yourself the rest of the 6 days of the week,
Yes. And boys are also, fall prey to a lot of body bullying, just like girls.
100%. Yes,
And so it sets them up for that, not only for binge eating disorder, but also for bulimia.
for sure.
Can I want to ask a question in regards to binge eating. As we all know, the GLP-1s have just taken off and a lot of
Mhm.
people are using them. How does this kind of intersect with binge eating and I mean just the eating disorder community at whole?
Well, about 30% of people in weight loss programs have an active eating disorder. So that is one thing we need to watch out for. What
30%.
happens when someone with an eating disorder is prescribed a GLP-1 medication is that they are really good at weight loss usually. They will take higher doses. They are not taking it for pre-diabetes or for diabetes. They are taking it specifically for weight loss, and they will often stop eating. And then what happens is when they're trying to go off of the medication, they are so fearful of the weight regain, which we have seen. We now have plenty of research that shows that the weight loss is rapid and the weight regain is rapid. So people either have to stay on it forever, or the eating disorder world can help with this. We can help people eat mechanically. That is the type of dietary eating that is used with people with anorexia when they are completely out of touch with hunger and fullness. And you see with, the GLP-1s, there's no hunger there. And so the eating disorder, if you have had this and taken medication and you're scared and now you're going up and down, or you are bariatric surgery as well, we really work well with this population because we can teach them how to eat mechanically to stop the weight regain. And
What do you mean by mechanically? I don't know what that means.
well, it's a prescribed meal plan from a dietitian, and you follow that prescribed meal plan. There is no, I'm hungry, I'm going to eat now, or I'm full, I'm going to eat now. You eat frequently throughout the day, but it is eating based on a prescribed plan versus hunger and fullness. It also goes along with binge eating disorder because one of the things that we know about binge eating disorder is that there is heavy duty under eating, heavy duty restriction in someone who binge eats. So they're physically hungry and then they binge later, just like I said for the boys. And people with binge eating disorder do that every day. They usually don't eat very much throughout the day and then they eat a lot at night. So it's putting them on mechanical eating where they will eat breakfast, lunch, snack, dinner, sometimes an evening snack, depending on how late they stay up.
And I think it's important that we kind of describe what a GLP-1 is, right? The GLP-1s are going to be like the, however you want to say it, semaglutide or semaglutide, and then tirzepatide, the Mounjaros, Ozempics, Zepbounds, Wegovy's. So these are the prescriptions that providers are calling in for their patients. And coming from a provider, I write these prescriptions quite often. And I usually recommend along with that is, getting with a therapist, right? Who, if this is truly a binge eating disorder, or getting with a nutritionist, because these patients have never been taught how to eat, right? Especially growing up in this central Texas area, right? Where, and I'm sure this is everywhere, but when we celebrate with food, right? We celebrate around a table, we celebrate with meals, right? And so teaching them that celebration doesn't always have to equal overeating or eating terrible food is honestly a big part of that treatment. So
it is learning how to eat things in balance and not just doing the swing back and forth. Oh, I'm going to cut out everything so that I can never go to a family celebration. This is Easter weekends. The holidays are very difficult for people with eating disorders because they either constantly overeat at these. And think about it, a lot of cultures that are here in San Antonio, the mother shows love by providing food and food and things that we normally don't eat. So we're going to eat all of it. Food insecurity leads to binge eating because we don't know if we're going to have it tomorrow. So we're going to, eat all of it today. Absolutely. So thank you for being a provider that does that. That says, hey, don't just take this medication, but go to a dietitian that knows how to treat this, and also go to a therapist so that you can discuss what you're doing and what your mind is doing around eating. Sure. Remember, that's what an eating disorder is. It's a mental illness, which means it's a lot of thinking and a lot of emotions about eating.
Absolutely.
And your body.
I think there's a huge place for this class of drug, right? I think that it has been extremely helpful in a lot of our patients, not just our type 2 diabetics, but our patients who deal with true obesity, right? As a chronic condition. But I also know that people are getting it online and it's being sent to them in the mail. And they're, like you said, dosing themselves. And I'm sure that people are overdosing or taking more than the recommended dose. And that, in my personal opinion, that's when it becomes a problem, because as you very well know, you can lose a lot of weight with these medications to the point of being underweight, right? Or malnutrition. And I have said this before. We did a whole episode on weight loss medication. And I said, these need to be prescribed by a provider, and they need to be where you physically go into a clinic, right? I just think that they need to be weighed and monitored. And my patients, I've had a couple saying, well, I can just get it offline and just, get it mailed to me. And I never have to go in and weigh. I never have to go in and get blood work done. And I don't know. I don't feel comfortable with that. I'd rather these patients be seen by me, right? And so that's kind of my program. And some of them won't come back, right? Because they don't like that.
Right. And just know truly that about a third of people are misusing it. If they, and we want people to also hear, if you're on one of these medications, we can help you from the eating disorder field, because we can also really teach you how to eat with them and to follow the prescription of the lower dose.
Sure.
Instead of ramping it up and doing damage to your body.
Correct.
Absolutely. We mentioned the fact that we live in Central Texas, South Texas, and how we have a lot of potentially family members that make you delicious food and you must eat it. And I know that we had talked about how when you were kind of done with your training, you looked and you saw South Texas is really missing any resources for the eating disorder community. I know that kind of inspired you to create the Esperanza Eating Disorder Center, correct?
Yes. And so back in the day when I first came back to San Antonio after learning how to treat people with eating disorders up in Boston, I was working in the military at BAMC and started the eating disorder program there and found out at that time, which it continues to this day, that the military community has a higher prevalence rate of eating disorders, all the eating disorders, and the newest eating disorder, before I go into the general population, the newest eating disorder, which is called avoidant restrictive food intake disorder, is the picky kid, the kid that, doesn't like to eat something because of sensitivities. The military has such a high rate of this that is unfound because of, think about it. Your family moves every 3 years, so they miss all of the, delayed growth and the weight not going up. So love that I work with the military, and Esperanza serves the military. And in our community, there's just such a lack of knowledge of eating disorders. So we are just training all over the place and trying to train providers so that we can bring the knowledge of, let's identify the eating disorders, let's give hope to people because of all of the newest types of treatment are really effective if we catch people at an early stage. Otherwise, people are, in their 50s, 60s, coming into, having lived a whole life of having an eating disorder. And it's a really sad life.
Well, and it's a lonely life, right?
It's a lonely life. So lonely.
I feel like a lot of people don't bring this up at appointments, because they're worried about being judged. And this is why Brittany and I created this podcast, right? Because people can just listen in their car on the way to work and listen to this podcast where Brittany and I banter back and forth about, women's health. And then they can take that and use it as a tool to talk to their provider. And our hope is that with this podcast, it gives women tools and it gives them the guts to bring it up, right? Because I can only imagine how lonely it is as a woman when you're trying to hide all of that, right? You're trying to hide that from your spouse and your kids and your work and your friends, that you're dealing with this emotionally. So I really am glad that there's a center like you have with Esperanza for these women and men and young children to go to where they can be truly listened to and not judged. I mean, that is like the whole basis of our podcast.
Yes. And I want to talk about, just briefly, there are two types of treatment that I want people to hear about. One is our family-based treatment. That is the evidence-based, which means it has the most research behind it to be highly effective for the adolescent with an eating disorder. And it's called family-based treatment. We do that at Esperanza. It means the parent comes in. We train the parent on how to feed your child with an eating disorder. And parents may think, oh, I know how to feed my child. Not with an eating disorder. The dietitians know how to feed them, prescribe the meal plans, and the clinicians help you in how to hear the eating disorder voice coming out of your child. They will know their child better than we will, but we will know that eating disorder. And so all of our therapies for the adolescent are truly about helping them with their body image, helping them learn the behaviors and skills, which are coping skills, on how to recover, but also teaching the parent how to take care of them when they get home. For the binge eating disorder, which is so prevalent, it's the highest prevalence rate of all the eating disorders here in San Antonio.
Can you explain to our listeners what binge eating disorder is?
Yes. Binge eating disorder is a disorder where someone overeats. And when they're overeating, they are mindless about it. It means you can be watching TV and eat a whole bag of chips. Now, people will say, and usually there's some kind of underlying emotional reason that they're doing this. Let's say, their boss yelled at them that day, or they got in trouble at work that day, and they're stressed, or they're stressed about their weight, or they're stressed about an exam, or they're stressed about, their marriage. So there's usually some kind of underlying emotion. Now, everybody will say, oh gosh, we all overeat periodically. Yes, we all overeat periodically. The person with binge eating disorder usually overeats multiple times a week, undereats as well. Undereats because they're upset that they have overeaten again. So the next day they'll wake up and be back on that diet or back on the, I am not going to eat anything other than a salad all day. And then they get so hungry and overeat again. That eating disorder, believe it, everyone out there, has the highest success rate for recovery because there is a type of treatment specifically designed for binge eating disorder. And it's not weight loss. It's not weight loss. So can I read a testimony from someone who just finished that? It's just a paragraph.
We would love that. We would love that.
Because I want to give hope to people that just say, gosh, I've been on diets all my life. I'm trying so hard to lose weight and I just can't do it. So here we go. This is from a middle-aged woman. I came to Esperanza having given up, completely hopeless. I had tried every diet in the book. My husband was avoiding me, and we had multiple arguments about my health and my weight. I just couldn't face even the idea of one more diet. I had given up on ever being healthy and had just decided that I would be fat and die early like everyone kept telling me I would. I was living with the constant belief that I wasn't good enough, strong enough, or determined enough to get thin. And I was just going to go downhill from here. I felt unlovable. Coming to Esperanza was a last-ditch effort to do anything. It may well have saved my life. It definitely saved my quality of life.
Oh, it's awesome. That gave me
There's
goosebumps.
so much hope. There's so much hope.
Yes.
We have great therapies for binge eating disorder as teenagers, young adults, and older adults.
Awesome. Awesome. That's the good stuff.
I know, that was really sweet. I think the big takeaway from this too is that there is not this perfect, candidate's not the right word, but it comes in all shapes, sizes, sexes. There's not a certain age that you're seeing. It's everywhere.
It's everywhere, and it's starting earlier. Esperanza, at our higher level of care, will take someone 13 and above, but we certainly do evaluations on the 10-year-olds. And then, we work with the family on how to take care of that. Now, also, eating disorders are highly heritable. So we see here in San Antonio, a lot of our parents have eating disorders as well. And we work with them too on their eating disorder.
And I think you explained something to me about how part of the recovery process and something that you offer is teaching people how to cook in the kitchen. Is that?
Yes, we have recovery by doing.
I think that's a really cool thing.
Right. You can't, well, okay. So eating disorders are thought-based and emotion-based, but they're also end up in behaviors. And the behaviors are usually avoiding things like avoiding cooking, avoiding grocery stores for sure, avoiding restaurant outings, avoiding learning, plating and sitting down at a meal and all those things. So we have a philosophy here at Esperanza called recovery by doing. So every day there is a doing group with food, learning how to
cool.
cook.
That's great.
Yeah.
Very, very cool.
Great.
Yeah, absolutely.
Yeah, especially because I know that a lot of, women, just don't know how to cook a healthy meal. Men as well, right? They don't know what that means because where they grew up, this was healthy because it fed them, and that's what put food on the table, right? So,
or they make a tasteless, meal.
Yes,
we're like, no, let's eat good stuff that tastes good. It doesn't have to.
That's so true. They eat lettuce,
right.
Just lettuce.
That's right. We're not
that sounds
just
terrible.
Exactly. And then we all eat here. We all eat we eat and show people how to eat and bring families in, and they all eat together, and we coach the families, and we help people eat throughout the day for their blood sugar levels and for their, just regulating their hormones.
So after listening to this, if a lady wanted to come see you or wanted to get involved with Esperanza, would she just have to go to your website to set up like an evaluation?
Yes, or call in. We do have a way to do this on our website for Esperanza, but we also have, our phone number. If you call in and say, "Hey, I'm just looking to ask questions and check on maybe it's me or my loved one. Can you do an evaluation?" We give you lots of information because we want people to really know how to treat this and take care of their loved one.
And I know this is going to be a question for patients. Do y'all take insurance? Is this an insurance?
Oh, yes,
based
we
thing?
take everything. Okay, here we go. I'll be quick on insurance.
I love it. I love it.
All the private insurances, Blue Cross, United Behavioral Health, Humana, Aetna, Cigna, we take all of them. Last year, we got Medicare. So now we are VA Medicare.
Yes.
And now they told us it would take a whole nother year for us to get to be Medicaid. But the minute we get to the Medicaids and the Medicare together, guys, we're like it in the state of Texas. Otherwise, we have to send people way out of San Antonio. Yes. So we're super excited.
Yeah, and I think that is the access, right? It's the access for patients because I know going over more to the psychiatric side, most psychiatric places do not take insurance. So there's so many people dealing with mental health that they can't get help, right? So the fact that you take insurance is huge for these patients. So I'm so thankful for that. So thank you.
Well, thank you. That is our philosophy. We are here to help the city of San Antonio, the surrounding areas, and if someone comes in from out of town to Esperanza, the Ronald McDonald House, we have slots and places.
Yeah, that's awesome, man. Y'all thought of everything. I like it.
Thank you. We're trying to be a resource.
Absolutely. This has been so great. I think this is going to help so many people. And we're so grateful that you took some time to talk to us.
Thank you.
We will provide all of the resources we talked about with you on our website and definitely have a link to your website as well. So are we missing anything? Anything additional you'd like to add?
The only thing I wanted to say is it makes sense if a transitioning person is not comfortable in the body they see in the mirror for them to manipulate their intake and develop an eating disorder. And we do know how to address that issue. We've been doing that for 6 years now. That's another area that I think parents might find hope to come here at Esperanza because we are, we do that, I think, very well. Also, if you have a picky eater and they continue to be a picky eater in elementary school, we do very well with that as well, moms, so that you have some hope and some help. We're here to help.
I love how inclusive you guys are. So thank you for being that person for these people. That's really, really awesome.
Absolutely.
So thank you all. I hope people, first of all, thank you for inviting us. That is, as you can tell, that's our goal, to get the messages to our community.
For sure.
Absolutely.
Well, we will, when this hits, I think it'll obviously be shared on social media, and then we will make sure that it gets to the masses. So thank you so much.
And we will send you all the links to the resources.
Okay.
Yes, ma'am. That sounds great.
Yes.
Absolutely.
So thank you.
That was so good. I really, really enjoyed talking to her. I feel like she really opened my eyes, even though I see this in practice with some patients. She really did open my eyes to kind of maybe other things that maybe I wasn't looking for. So I hope that was helpful for our listeners too.
100%. And though how passionate she is when she's talking, like you can't help but want to listen to her talk. So I mean, thank you so much. Let's give her another thank you. That was so wonderful.
I really hope that if somebody's listening and lives in this area, or maybe if they just don't live in this area, they can reach out to her, because I think that she could offer so much help for various reasons, not obviously just bulimia or anorexia, but other things that she talked about, right? So like the picky eater, I hadn't even thought about that being an issue, but the picky eater is obviously an issue, right?
Oh, girl. Yes.
Were you a picky eater?
Absolutely not. But I certainly have some younger cousins that thrive on tortillas only. So,
Ooh, yep.
Yeah. Moving on. You ready?
Ready.
It's about that time.
Ooh, for slippery solutions with B and J. I think I'm getting better. I do.
All right. We have some good ones. Ones that I think a lot of people have these questions. So I'm glad someone actually wrote in about it.
Okay. Great.
Okay. Dear B and J, if I am on my period, should I reschedule my OBGYN visit?
No, absolutely not. And I think this is a common misunderstanding, right? Women think that if they're on their period, we will not want to or cannot do an exam. You might feel like super self-conscious about it, but you probably are not the first bleeding vagina or the last bleeding vagina that we are going to see for the day. So I never want you to feel like that's awkward. The one thing I must say though, is if you're coming in for a pap smear and it's for your annual exam and you're needing a pap smear that year because you're due for one, it might make the pap smear inconclusive. And so it might show that we weren't able to get enough cells because of the blood got in the way. But as far as it being off-putting or weird or, I don't know, cringy, no, not at all. Not at all. Doesn't bother us in the least bit. So come on in, sister friend.
Agreed. And what's interesting is I think there are some people out there that if their period does come, they're like, thank you. I get to avoid this for a little bit longer.
Or they'll push it off a whole year.
Right. Exactly. I had my period in March, so I'm not going to see you until next March. Hope that's okay. I mean, it's a real thing.
Oh,
okay. So this kind of piggybacks a little bit, but dear B and J, do you care if we shave for our appointment? Does it make things easier?
Oh, okay. So this is a good question. If you are coming in for something where I'm going to have to do a pelvic exam, like inside and look inside, like inside the vagina or at your uterus or your cervix, I really don't care if you've shaved or not shaved. Like I half the time don't even notice it, right? Because that's not what I'm looking for. But if you're coming into me because you maybe have felt a bump on the outside or you have something that you're concerned about, like a mole or maybe a cyst or something that's hard to look at or hard to see, then maybe shaving around that area is not a bad idea, or trimming the hair around that area is not a bad idea. So I can actually get a really good look. If it's a large amount of hair and a lot of hair, I sometimes am not able to see that little area perfectly well. And it does help if you kind of trim that hair around it. But as far as coming in for just your annual exam and you have no complaints or maybe pelvic pain or hormonal consult, no, I really don't care. Whatever you want to do, whatever's comfortable for you. I really doesn't bother me either way.
Right. And as we've said before, the bush is back.
So it is.
Embrace it if you want to.
Yes, girl.
Yes. And as a reminder, we really don't see things anymore because after doing this every single day, nothing really phases you. So just know that we are not focusing on that at all.
Nope, not at all. Like, not at all. And I do think that's a really great point to bring up is that, like you said, we see this all day long. So it's not something I'm thinking about as I'm doing your pelvic exam. I'm truly just looking for abnormalities and making sure that I don't see anything or feel anything on exam that could mean that you need further testing. So yeah, all good.
Cheers, Jeanette.
Cheers. What a great episode.
Yes. As a reminder, we're going to have all of the resources that Dr. Mengden mentioned. We will have that on our website. And again, if you would like to get in touch with Dr. Mengden, she started the Esperanza Eating Disorder Centers. And again, there's limited resources for this, and she has a plethora of them. So please use her as a resource. And again, thank you so much. That was it was really, really informative.
Absolutely. Super insightful. So I'm excited for y'all to hear it. And obviously, if y'all do have questions and maybe you have specific questions about this episode, feel free to message us because we can always relay those to her and get you some information. Like if you need specific information that we can always get from her too. So we'd be happy to pass that along.
Yes. And lastly, Jeanette, I'm going to a bachelorette party in Palm Springs.
Watch out.
The next time you talk to me, I'm sure I'll have great stories.
I cannot wait to hear these stories. Oh, wait, we talked about this last time. Were you able to go to the sex store?
Yes.
Oh my God, I want to hear it. Oh my God.
As I told y'all, it's been quite some time since
Were
I've
you
been to
so
one.
overwhelmed?
It's very overwhelming.
Yes.
And I am shocked at like what is available. Absolutely shocked. And I'm not appalled, but I'm shocked.
Well, it takes a lot to
Yes.
appall you. So I love that's my favorite thing about you.
Yes. But I will say there's definitely more, there's more of a variety than when I last went. So,
okay.
Yeah.
Okay. Well, now I can't wait to ask you questions, but I'm going to wait till the next episode.
Okay. That sounds great. All right,
ladies. Well, thanks for listening. And gentlemen, thanks for listening. We appreciate you.
We'll talk to y'all soon.
Bye. The information provided in this podcast is for general informational and educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.